Now, a big thing in our office is patients will tell you everything if you just ask the right questions and listen. So one of the things I said, well, what are you nervous about mostly? She said, well, my neck feels good, my shoulder feels good, but I'm nervous if I go back and do what I want to do, it's going to hurt again. I said, okay, here's what I want you to do. Before we continue on, I want you to go home this weekend and do everything you think you want to do that could cause a problem. Come back on Monday and let's discuss it. Sure enough, she came back on Monday. She came into the office with me and she said, look, my neck feels great. I'm having a problem down into my shoulder and my arm again. I was looking down, I was sewing, I was reaching out, I was doing this, I was reaching up, and I said, hold on a second. I said, pause for a second. I think you just told me everything. The neck feels good. When you look down, it bothers you, but a lot of what you're reaching and using the arm is what was causing the pain? Yes, that's right, Dr. Jeff. I said, okay, have a seat. Let me check something. So I actually did a few tests on her rotator cuff, her supraspinatus, her subscapularis, infraspinatus, and her teres minor. I did some testing, preliminary testing, and she failed them all. And I said, SK, I think you also might have a rotator cuff problem. And her eyes got big. She said, you know, I've been saying I've had a shoulder problem forever and no one's listened to me. I said, listen, with where you have all the damage in your neck, you can also feel it in this area, and that's why it could have been confusing. But before we move on, are you okay with doing an MRI of your shoulder? Because I think we have two problems going on. And sure enough, she said, please, let's do it. We immediately sent her for an MRI, and the next day we got the report back. And the report actually showed she had a full thickness tear of the supraspinatus tendon,